Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas. In the studio with us as always today will be Bill Kearney of Northlake Medical Pharmacies. He's getting cozy in the chair, taking the jacket off here and getting ready to roll. How are things going with you, sir? And how are the ribs? And
are you talking about at the restaurant or?
Well, we've got the holiday season is officially in swing, and my wife was in the store yesterday and said you've got the decorations starting to go up, and this is the big push here for a lot of people, retail and and small businesses here in Lakeport, and hopefully it won't be too bad of a flu season. I think there's lots to talk about today.
Yeah, we do have our Christmas up because our competitors all had it up in September.
It's crazy, even in August, some of them.
And I was in Sacramento, I guess, to see one of my daughters, and stopped in the Costco there, and of course they had it up a month ago.
Yeah.
And in fact, I think it was back to school time that they were putting Christmas up.
Yeah.
We of course are a small business, and we don't sell a lot of the things that the big people do, but we do have lots of gifts and still ordering more. But yeah, we're getting ready for another holiday coming up here, Thanksgiving, and the flu season is starting. And I thought I had most of the day today to stay dry outside. I'm having some work done on my deck, and the guys were there at 7 o'clock this morning, and
was it raining on them?
And it started raining about 8, and so we think about everybody's health when we have these this winter approaching, and want to remind everybody that we have free delivery from our pharmacies from Kelseyville to the Rivieras, Buckingham, Lakeport, and East Lucerne, Upper Lake. When you don't want to get out in this weather, hopefully we're going to have a good winter and a wet winter, so we'll fill up that lake again. But of course, with the flu season coming up, and I was trying to find an article that I saw last Friday in the New York Times, and it was about this could be the worst flu season that we've had in some time. And I wondered how, every time I give a shot, I look at people and say, this is supposed to work with such and such a percentage, and the flu vaccine we have this year is supposed to be the right one for the strains of flu, even though we know they mutate as they travel across the country. And then I always say, well, I don't know how we would know that these are the right strains of the flu vaccine when we don't even know what the weather is going to be 24 hours ahead of time. But supposedly there's a way in Chicago that has been very successful in predicting the flu season, and this is supposed to be one of the worst, although it's it's having a slow start. But if you haven't got your flu shots, make sure that you do get one, because if you don't have a shot at all, you don't have any protection. And remember that the flu shot does not give you the flu. This is an inactive virus that you can get immunized. It takes about 10 days to 2 weeks to get in your system. And as you think about Thanksgiving approaching and being next to people that maybe you hadn't been around for some time, and kids out of school, and people in confined areas because of the weather now, think about getting yourself immunized with at least flu. And if you're over 65, of course, getting your pneumonia shot. Many of you got the Prevnar last year, and if you haven't received the Pneumovax 23, then you need to get that one. So if you've had only one flu shot and it's been a year, you need to get another one to make sure you're up to snuff. I had just printed an article out, and I guess when I went up to complain about the noise in my office to the people working on the deck, I guess I didn't bring it, but about people not getting immunized now. And one of the articles I read was about mumps. And even though people have been immunized and they've had their there are 2 MMR shots, which is measles or mumps, rubella, and measles, that you need to have protection with those 2 shots. But as we look at what's happened in the last couple of years, there are people that have gotten those 2 shots as children growing up and have had the measles and the mumps also, and they're still getting mumps again. There was an article from the University of Iowa where they had 120 students that got mumps, and most of them had already been immunized. And they were suggesting that some of those people that were more susceptible get actually a 3rd shot of MMR. And they don't suggest that everybody does, and everybody doesn't panic and think that there's a wild outbreak of mumps, but it happened last year in professional hockey. A lot of these, I think it was in the Midwest, one of the hockey teams got it, and then another one of the hockey teams had a influx of mumps. So just because we've been immunized a long time ago doesn't mean that you don't need to be immunized now. And the other thing that came up was whooping cough, or pertussis. And most of us have been immunized for that, and now that shot is tetanus, diphtheria, and pertussis, or whooping cough. And the one that they're most concerned about are the mothers that are pregnant, that are having a child in the last trimester. They want that mother every year to get a Tdap shot. It gives the baby immunity when it's being born, and otherwise the baby has no immunity. And also the father and the grandparents and any adult that's going to be around an infant should also get that Tdap shot. And the other one that we always have on our questionnaire is tetanus, and the tetanus is included in that triple shot with the whooping cough in it. So it's called a Tdap shot. And every 10 years you need to get a tetanus shot. And every time I have somebody fill out a questionnaire, many of times there's a question mark about the tetanus. Now, many insurances pay for that Tdap shot. You don't have to be on Medicare, but many of them don't also. So that's something you need to check on when you come in and get a flu shot. We just got another shipment of the quadrivalent flu vaccine in, which is stronger than the one that you had last year. And last year I just read again in the Times this morning that it was 47% effective. This year it's supposed to be 67% effective. And you think, well, why should I get it if I'm going to get the flu anyway? Well, the chances are if you do get the flu, it will not be as intense as it would have been otherwise, and it won't last as long. So certainly the amount of people that I immunize every year, probably around 500, I get the comments all the time about I never used to get a flu shot, and then I got the flu. And it would be amazing to you the amount of people that that had a severe bout of the flu that thought they weren't going to make it, and at least 20,000 die of the flu every year. So we don't think about us being susceptible, but I did a lady's flu shot yesterday, and she said, I said, did you get the pneumonia shot also? And she says, no, I don't need it. She was over the age of 65. And I always think, gosh, Medicare pays for it. It's no investment to you to protect yourself. I would think that you would get the shot, but I'm not the master here. I'm not supposed to force you to get a shot, and I won't, but I can strongly advise you at times that it's certainly the way to go. So just keep that in mind as we get into the holiday season and we start talking about other things, and then we wonder at the time whether we should have gotten a flu shot or not. With the coughs and sniffles around, many people are eager to get the flu vaccine while others are avoiding the shot like the plague. And The nasal vaccine, remember, is largely unavailable in recent years, and are urging the public to get the vaccine in the shot form as it starts getting into the winter months. While many are lining up to get the influenza vaccine, others are skeptical of the shots. So there are some myths according to this, and we've talked about those before. I'm repeating this to a lot of you who've already been in and getting shots, but the seasonal flu is a serious disease that causes deaths every year in the United States. The myth is that the vaccine causes the flu, and that isn't true at all. And we wonder, that rumor came from when we had a live vaccine that we were giving to you. Now it's an inactive vaccine. So the elderly and the very young pregnant women are not allowed to even get the live virus. And most of what we are giving is the inactive virus. So it's important to recognize the side effects of what the shot is versus the actual flu. You may get a redness around the injection site, but it's extremely rare that anyone would develop a more serious reaction because there are so many people every year who actually die from the flu. They're limited to feeling a little bit under the weather, but they're usually only a risk. Much like any other vaccine, it's not 100% effective, but if you do get the flu shot, it's going to be extremely reduced. And there's also a myth that pregnant women should not get the flu shot, but that's not true. Children under 6 months old should not get the vaccine, but everybody else, including pregnant women, should get the shot for their own health and that of their unborn child. So when the mom gets the shot, the antibodies that makes will get passed on to the baby, and so when the baby's born, it's already protected against the flu for a couple of months. The people over 65 are one of the high-risk groups that need to get a shot. There is the high-dose concentrated vaccine that some of the people are demanding. We did not stock that at the Bruno store. The one in at Hill Road has. It's just a concentrated version of the regular flu shot. They don't really know that it's more effective. What they do know that it may last a little bit longer in the system, so the elderly are covered a little bit longer than the younger person. Of course, that makes no difference if you get the shot early and it runs out of potency. That's why we suggest waiting till October to get the shot. We used to think if you had an allergy to eggs that you couldn't get a flu shot. That vaccine is incubated in an egg and contains a small amount of egg proteins, but we don't have any concern about that anymore. There's just a small amount of egg proteins. The risk of getting it is far less harmful than the benefits from getting it. So what we used to excuse me, what we used to do was observe a people for a period of time in a hospital setting before getting the vaccine if they had an egg allergy. But when updating the guidelines on the condition in the vaccine last year, the CDC eliminated the 30-minute monitoring recommendation that examined the use of both the nasal spray vaccine and the flu shots in allergic and non-allergic patients. And the severe allergic reactions in people with egg allergies are very unlikely. So the last one is the autism thing, the most controversial of all the myths, that the vaccine causes autism in children. There's no scientific evidence. That came from a rumor that was in England about 10, 15 years ago. There isn't anything clinically that links the flu vaccine to causing autism, and what they thought was the mercury that was included in the vaccine could have initiated an autistic response. But there isn't any evidence to back that up, so we're not advising you not to give a shot to a child, especially with the risk out there of getting a more intense flu. I had a phone call yesterday from a physician, and we talked about this in the last couple of weeks. There was a new vaccine for shingles that just got approved by the Food and Drug Administration for the prevention of shingles in adults 50 years and older. It's a non-live vaccine giving intramuscularly for 2 doses. What's different about this vaccine is it's, number one, it's an inactive vaccine like the flu vaccine. It isn't a live virus. Another thing that's highly indicated is it's 90% effective across all age groups, where the most that we got out of the Zostavax shot was about 60 to 80%, but more like 60. It's shown over 90% efficacy across all age groups in the prevention of shingles and potentially serious disease that affects 1 in 3 people in the United States. You know, we don't think about kids getting shingles because it's usually the risk and severity of the disease increases with age as you begin to get older, the risk becomes greater. So clinical trials evaluating its efficacy, safety, and the ability to immunize you in more than 38,000 people, it demonstrated effectiveness across 90% groups, as well as sustained over a follow-up period of 4 years by preventing the shingles. And it also reduced the overall incidence of postherpetic neuralgia. Now, that's the pain that comes from shingles. As you get shingles, the nerve endings from underneath your skin get exposed to the outside, and it's like having a root canal. If you've ever had a nerve exposed in a tooth, this is all over the area that you have shingles. Could be under your breasts, on your back, in your eyes, in your head. It's a form of chronic nerve pain, which is the most recognized symptom, actually, or complication associated with shingles. The vaccine is made by Glaxo. They provide partnering with the public health and medical community to address the gaps. The U.S. Center for the CDC is expected to vote on the recommendation at its meeting, which they did, and it passed 7-6, I believe. It will be available shortly, but when I got this call from this physician, he said that he expected it to be out right away. And I said, well, you've got to get it approved for third-party billing. You have to get it approved for the Food and Drug Administration has to have an administration policy, and but it was approved in Canada for the prevention of shingles in people 50 years or older, and in the European Union, Australia, and Japan, it's underway. So I think it's going to get approved rather quickly. There's an estimated 1 million cases of shingles in the United States every year. One more than 99% of those over 50 are infected with herpes, and 1 in 3 Americans will develop it in their lifetime. The risk increases to 1 in 2 adults for aged 85 years and older. This is something that combines 2 different antigens intended to generate a long-lasting immune response, and you should not receive it if you're allergic to any of its ingredients. The most common side effects are pain and redness and swelling. You need to ask your physician or your pharmacist about the side effects, and it's not indicated for the prevention of chickenpox. The physician I was talking to, he said, "What's the name of this vaccine?" And I told him it was Shingrix, Shingrx, or RIX. And he said, what if a physician just wrote for the new shingles vaccine? And I said, we would know what you were talking about, as there's only one other one other than Zostavax, and we will let you know when that becomes available, because it'll be one of the shots that we do give in the pharmacy, which is one of many. So just be aware that there isn't to be a booster shot for the ones that you're on right now. It is, and the protection is probably dwindling, as it's been, I think, 8 years since that was given out on the market originally, and they thought at the time it was only going to be good for 6 years. So I don't know of anybody. I know of 2 people that got the shot and got shingles. It wasn't as severe as it would have been if they hadn't got the shot. But there's nothing to say that you can't get any disease from any shot, that you are going to get any kind of a disease that you're going to get immunized for. A couple of the articles that I didn't bring, one was about how alcohol is causing cancer, for any kind of cancer, and we all know that it can be a dangerous combination for people with depressant medications, blood pressure drugs, cold or allergy medications, pain relievers. If you're a drinker and you, what they've always told you before is you could have, as a female, 1 glass of wine or 1.5 ounces of distilled spirits. The problem is a half a glass of wine. Some of these wine glasses can hold up to 22 ounces. That's more than in 4 drinks. So you might want to use a shot glass to get it right. Keep tabs on how many drinks that you have a day per week. Alternate with water if you're drinking at a party. Sipping a glass of water or a club soda after each drink will help slow you down. And if you're concerned about your drinking, talk to your physician about it. If you have a kidney disease or a liver disease that makes you more susceptible to having a reaction with alcohol, there's more than 100 studies that have been found a drink or 2 a day is linked to 25 to 40% risk of heart attack and stroke. And in August, one that followed more than 333,000 people for 12 years found that light to moderate drinkers were 21 to 34% less likely to die from cardiovascular disease. But no one really has proved directly that it boosts human health. And we've heard about red wine, that a glass or 2 a day is healthy for you. But as times change, as we go on, we learn other things, and we look for new reasons that some of these things may be good for you, and some of the reasons that they may be bad for you. So I think it's like anything else until we get a definitive answer on these things, that we know when we drink alcohol it's a risk. I mean, we say every day that a glass of wine, my father was an alcoholic, and he would, and he was also at risk for a heart attack. He had a heart attack when he was about 50 years old, and then another one later, and then he died of a stroke. And he said that the doctor told him he needed to drink a glass of alcohol a day, a drink of alcohol a day, to cut down his risk. Well, he would not only drink a drink of alcohol. He would pour a water glass full, and that's what I saw. I didn't see what other amount of alcohol he drank, but eventually it killed him. Now, you also hear about people that are 100 years old that have a shot of brandy every day and smoke 4 cigars and do just fine. But that's the exception. So, as you know, these things are, if you're not healthy to start with, can be just an added factor in your life being shortened considerably by the excessive use of these things. We're going to take a little break, and when we come back, we're going to talk about the high cost of people not being compliant on their medications, and also how Coumadin or warfarin may prevent cancer. Hi, my name is Bill Kearney, pharmacist and owner of North Lake Medical Pharmacies. Do you take non-prescription medications to relieve your headache, fever, or arthritis? If so, you're not alone. Americans consume more than 50 billion non-prescription over-the-counter medications each year. When taken as directed, they are safe and effective, but they're still serious medications. At North Lake Medical Pharmacy, our pharmacists want you to know they are always available to talk to you about your medications, including over-the-counter medications. So talk to our pharmacists for your good health. We also want you to know that we care about your health. By working together with our pharmacists, you can get the most out of the medications that help make you feel better when you're sick or help keep you healthy. So remember, talk to our pharmacists for your good health. North Lake Medical Pharmacies, with 2 locations to serve you, on Hill Road next to Sutter Lakeside Hospital, and outside the Bruno Shops Mart at 347 Lakeport Boulevard.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, November 3rd. Mostly no planned work November 9th through the 12th in observance of Veterans Day, but crews will respond to emergency situations. In Lake County on Route 20 at the Upper Lake Drain Channel Bridge, weekdays expect 5-minute delays, and at Country Club Drive on the 7th expect 5-minute delays. On 29 at the Lakeport Boulevard overcrossing off-ramp, that'll be fully closed for a night starting the evening of the 5th. And on 175 near Arroyo Vista Road, weekdays expect 5-minute delays. In Mendocino County on Route 1 at the Noyo River Bridge, weekdays expect 5-minute delays, and south at the South Fork Eel River Bridge, weekdays expect 10-minute delays. On Highway 101 from Ridgewood Ranch Road to the Hermitage Vista Point, expect some delays. On 162 west of Pukini, weekdays expect 10-minute delays. On 175 near the Lake County line, expect 10-minute delays. And that wraps up the bulletin. Like us on Facebook for more updates and info on the type of work we're doing. That's Caltrans District 1.
The Lakeport Senior Center is hosting a free to all ages community Thanksgiving dinner on Thanksgiving Day at 3 p.m. by reservation only. To reserve a spot, call 263-4218. The center is relying on the community and needs donations of turkeys, turkey bucks, money, and time from volunteers. Businesses and individuals can sponsor, donate, or volunteer by contacting the center at 263-4218 or by dropping off or making donations at 527 Canocti Avenue in Lakeport.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their member of the month, Tom Lincoln from Lincoln Levitt Insurance Agency. Lincoln Levitt Insurance Agency insures hundreds of local and out-of-county businesses, providing such coverage as fire liability, business auto, workers' comp, umbrella liability, director and officer liability, and group benefits. It also provides a full line of insurance products to local farmers and agribusiness owners. To request an insurance review, Tom and his staff are located at 650 North Main Street in Lakeport. They can be contacted at 263-7162 or through the website at lincolnlevitt.com.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, Bill, we're back.
Well, we are. One of the articles that was in the New York Times today that I didn't bring with me, and I'll try to retain the most of it because it's a huge problem in my field in dispensing medications, and that is compliance with people taking their medications. And it seems to increase with age, the problem does. And they did several studies on how to incentivize the patients to take their medications. And the reason it's so prevalent with pharmacists are we're required to do medical therapy management. And if you look, especially if you're over 65, on almost every plan on Medicare D, will say whether you have MTM or not. And if you don't have MTM, which is medical therapy management, you get less of a reimbursement. Now, what you get in return is from us, is a phone call from us saying you haven't been taking your medication on time, your insurance company is saying that you're not compliant, and you may have trouble getting this insurance company to pay for your medication if you don't take it as prescribed. And we have to document that and send it in to the insurance company. I do at least 5 or 6 a day that I have to evaluate. So they thought, well, what can we do to have these people take their medications? They tried giving free medications to people. If you stay compliant, we'll give it to you free. That didn't work. They tried actually incentivizing them by giving them financial bonuses for taking their medication. That didn't work. They tried the vials like Target had available before CVS bought them out, telling you a talking mechanism that would tell you when to take the medication. That didn't work. And you're talking about medications that are for behavioral problems, medications that are for life-saving situations, medications that could debilitate you. And the people were just very independent about taking their medication. Over 50% of the medication that we fill prescriptions for either is never picked up or is taken home and never refilled. Now, if that's an antibiotic or something similar to that, or a cortisone that's just for an incident, or ibuprofen, pain medication, that's fine. But if it's a maintenance medication, like something for diabetes, something for obesity, something for high blood pressure, something for anxiety that's related to another indication, things for other disease states that you may or may not have, but it's typically, many times you have respiratory problems, so you're on inhalers. You also have diabetes, so you're on something to either stimulate your insulin production or increase the amount of insulin produced by your pancreas. There are people that have cardiac conditions where they have high blood pressure, or they're taking a statin. And the medication, if you're a diabetic and you're not taking a statin, we have to ask the physician to put you on a statin because it lowers the risk of you having a heart attack. So we're looking at ways, and probably one of the most difficult ones are, behavior problems where you're taking what we call psychotropic medications, which actually alters your brain function. You could be schizophrenic, you could be bipolar, you could have other mental conditions that require you to take your medication, and you're not doing it. I have patients that I've talked to them when I'd refill their prescription, and I'd say, you should have been out of this 2 weeks ago. Well, we're just evaluating the medication, and we're seeing, and then that excuse runs out. And I'll be okay as soon as I get my medications adjusted to the level where it's the most effective. And all kinds of reasons not to be taking that. And what happens with somebody that's bipolar, somebody that's schizophrenic, if they're taking the medicine correctly and it's effective for them, they don't have those behavioral problems. So all of a sudden, here's somebody that's been made correct by their brain functioning at a level that's productive for them and productive for society, and they thought, why am I taking this medication? I don't really need it. And then they quit taking it, and then they have a breakthrough. I don't know if this individual that shot all the people in church in Texas was on medication or not, but he was mentally ill. And many times that happens with people that don't realize that the reason that they're doing so well is the medication is making them correct. And it's kind of fascinating to me that when you have these diseases that are the silent killers, like diabetes, which you don't have a lot of symptoms from if you're, unless you're taking your blood sugar analysis and seeing how high your blood glucose level is or your INR is, then, or your A1C is, you're not going to know. And it's the same way with blood pressure medication, with finding out if there isn't real symptom for moderately to high blood pressure, but eventually when it gets to the level where it is symptomatic, you have a real problem. So, you know, I can understand why people think sometimes they felt better when they didn't take the medication, and now taking the medication, they don't feel as good. But you have to communicate with your healthcare provider, your pharmacist and your physician. And if you're insured, either by Partnership Health, Medi-Cal, or one of the regular insurance companies, they're going to ask us to monitor your taking of the medication and find out why you're not taking it. Do you have transportation problems? Is there no communication between you and the physician? And as we've talked about before, that's one of the reasons that we're having difficulty now with fewer and fewer physicians and people going to clinics. They don't see the same physician every time. I just had a patient that I was doing a Medicare D plan for that was getting 2 different drugs from 2 different doctors for high blood pressure, and they were both in the same category, meaning they both did exactly the same thing, and neither doctor knew the other one was involved. We also have that happening with controlled substances, where somebody is getting controlled substances from one doctor and the other doctor won't fill it, so the new doctor writes them a prescription for the opiate, which they were probably addicted to, and they're getting it from multiple physicians. With controlled substances, we have a tool that goes through the Department of Justice called Cures. So we can put your prescriptions, your name, and the date we want to monitor you into the computer to the Department of Justice, and they can tell us every place that you got a prescription for a controlled substance. The date, the pharmacy, the physician, the quantity, everything. You can't hide it from us. And in those conditions, in those situations, we're not going to urge you to get your prescription filled early or keep taking that prescription, because there is such an epidemic of overuse of opiates that we certainly don't want to encourage using that. I had a patient that was in yesterday that was taking an opiate prescription for many years, and her physician that was leaving wrote a prescription for a drug called Tramadol, which is a synthetic form of an opiate that isn't a Schedule II drug, and told her to take this instead of the opiate. When she went to the clinic to get a refill, the clinic physician said, "No, we don't want you on Tramadol." The Tramadol had been very effective. Then they put her on a different medication that would cause her to have other side effects from the other medication. And in situations like that, I think, you know, we have to stand up. You've heard me say that before. Be responsible for all your own care. And it's very difficult when you're talking to a physician about it, who is the person that writes your prescription. But there are alternatives to not using the Schedule II opiate. And we would suggest that if you want us to give you a substitute, we'd be more than happy to inform your physician, but they probably already know. In the medical news today that came out a couple of days ago, there was an article about Coumadin, or warfarin. And we use warfarin a lot for atrial fibrillation, and we also use it for deep vein thrombosis and blood clots. And it works by inhibiting the body's production of vitamin K, which is needed to form the blood clots. It's most commonly prescribed for those who have experienced a heart attack or a stroke or deep vein thrombosis, other conditions caused by blood clots. It may also be considered the gold standard for blood clot prevention. But there's been a lot of medications that have come out recently that are substitutes for Coumadin in those kind of situations. Excuse me. And the big advantage to those are that you do not have to take a ProTime and an INR every month or every week or every 2 weeks in order to find out if it's an effective dose. The disadvantage of those drugs are that they can cause bleeding to occur, and once they do, it's very difficult to stop the bleeding. Warfarin or Coumadin is different in the fact that you can adjust the dose of Coumadin when your blood is getting too thin or getting too thick, and or adjust your eating habits and change the effectiveness of the medication. This was a cancer study, and it was done, as typically so many of them are, in Europe. This was the Norwegian National Registry, and it included data on 1,256,000 individuals who were born in Norway between January 24th and December 1954, of whom more than half were females. They collected the information on warfarin use from January 2004 to December 2012. And the cancer incidence among the subjects was assessed from 2006 to 2012. Of those participants, 92,000 were taking warfarin. They found that individuals who used warfarin had a 16% reduced risk of all cancers, compared with people who did not use the drug. Looking at Oregon-specific sites, warfarin use was linked with a 31% reduced risk of prostate cancer, a 20% reduced risk of lung cancer, and a 10% lower risk of breast cancer. These are substantial. Additionally, they assessed how warfarin use influenced the risk of cancer development in a subgroup of individuals who were prescribed the drug for AFib, or atrial flutter. They revealed that these were at lower risk of cancer development overall, and they were less likely to develop prostate, lung, breast, and colon cancers. Taken together, the team believed their findings suggest that warfarin may help to prevent cancer. Their conclusion was their data indicate that warfarin provides a possible cancer protection, a finding that may have important implications for choosing medications for patients who need anticoagulation. They also noted that this is strictly observational, so they're unable to prove cause and effect. There are also a number of study limitations to consider. For example, they did not gather data on the use of other medications. They did not account for other factors that might influence the risk of cancer, such as diet, weight, and smoking. The team concludes that further studies are needed to determine the underlying mechanisms by which warfarin may protect against cancer development. It's important to note here that they did not do that. We don't know why warfarin worked. We don't know how controlled the study was. Typically, many years ago, before we started putting genetic factors and whether or not a person was male or female in the studies. We used strictly males. We used a lot of doctors and nurses, which, believe it or not, at that time when we were doing these studies years ago, were smokers. And the same thing with nurses when we started doing nurse studies. So there's none of that taken into effect. We don't know how much of this would change the results, or whether they would change the results or not. But we do know that it wasn't indicated here. So we have to be very skeptic about the future when it comes to using Coumadin to stop the risk of cancer. Remember, warfarin is it's rat poison. It's stuff that when you put it in mice or rat poison, they hemorrhage inside, but that's without a controlled dose. But it's a very effective drug. It's been the most effective drug for atrial fibrillation, and the strict disadvantage is not monitoring the use, not making sure that your protam and INR is within the healthy range and could get out of whack, and then you could be in trouble. So just another thing as we talk about, 6 months from now they may say that some other kind of disease increased by 50-fold by taking Coumadin when they shouldn't have been taking it, or warfarin. So one of the articles that I was going to talk about last week were health problems that only seemed like back pains, and pretty much everyone of a certain age has had back pain at some point. I, for example, right now with my broken ribs, I sit at a computer most of the day, and I lean myself forward. And since I broke my ribs a couple of times, I have to put in my briefcase behind me to support my back, because if I don't, by 2 o'clock in the afternoon, I'm all stoved up from a back pain. And back pain is a serious warning sign of a dangerous, even life-threatening conditions. But when you ask a doctor or somebody to figure out why you have the back pain, they will tell you almost everybody does. There was an example here of a 54-year-old patient who complained about back pain and turned out to have metastatic brain cancer. Now, this isn't done to alarm you. It's just to give you some scenario that that there could be something else other than your back. That's not a common scenario, and if the pain gets better when you take some Advil or Tylenol, then it's pretty unlikely that something that scary is going on. But it does happen, and it's smart to know what to look for. So here's a few health issues that are sometimes mistaken for run-of-the-mill back pain. An aneurysm, which occurs in part of the artery wall, weakens, allow it to abnormally or balloon out. Those bulges can occur anywhere. Aortic aneurysms refer to those developing in the aorta, the main valve into your heart. It's about 1 foot long, 1 inch in diameter, the largest vessel in the body, and it extends from the heart through the chest to the abdomen. Most of those aneurysms occur in the abdomen. In either case, an aortic aneurysm bursts, and it often causes back pain that radiates into the abdomen. So it's severe and it comes on suddenly. It wouldn't be something that all of a sudden your back started aching and gradually in a period of several days it got worse. That's the most common among men over the age of 60 who smoke or have high cholesterol. But anyone who has extreme pain in the back or belly doesn't go away should immediately seek attention. Appendicitis, of course, we know, and inflammation of the appendix have the traditional symptoms of nausea, vomiting, sharp pain. And you'd be amazed how many times this is missed. When you go in, this is always in your lower right side. You might have pain elsewhere in your midsection. You might develop lower back pain. And the reason is, although it usually resides in the lower part of your right side, about 15% of the people have their appendix in their back near a kidney. So when that organ gets inflamed or ruptures, they may complain of lower back pain instead of stomach pain. And most doctors learn about this in medical school. It's not usually the first thing we think about when somebody talks about back pain, but anytime you suspect you have appendicitis, you should seek medical attention because an infected appendix doesn't take that long to rupture, less than 24 hours after they begin. And if it sets in, it can lead to shock, and then you'll likely need surgery, and delaying it can lead to complications. So osteoporosis is another thing, which is low bone density. It's often called a silent disease also, like hypertension and high cholesterol, because it's common to have it and not know it. But according to a recent report, when people do have symptoms, the most common one is terrible back pain. Osteoporosis ends up weakening the vertebrae in the spine, and then the spine fractures. And those of us who have deteriorating spines to begin with, and when those bones break, they can cause sharp back pain that doesn't go away easily. That's exactly what happened with my ribs. But sometimes there's no pain at all. Either way, after having several of those breaks, you may develop a curved spine and then start to lose height. Paul, I used to be, how tall are you?
Oh, I could go 6'1", 6'1.5", you know, depending on the heels, I guess, on my shoe. I don't know. I guess I'm 6'1".
I used to be 5'7.5", and when I went in for my physical a couple of weeks ago, I was 5'4.5".
What?
I lost 3 inches.
Wow.
You know, I already wasn't a giant, but boy, to lose, and I stood on the scale, and that was with tennis shoes on, nothing,
Yeah.
you know. 3 inches I'd lost in the last 30 years.
You know, I wonder. I haven't actually been measured in a while, and you know, I don't know. I used to be like 6'1.5", but
Yeah.
you know, I'm sure that I slump a little more, and you know,
Yeah,
my
I
back
think-
kind of rounds a little
I
bit
think
more.
we all do. I tried to
Yeah.
stand up straight, but even then I roll
Yeah.
my shoulders or whatever.
It's hard when you know you're sitting at a desk and your body tends to naturally want to kind of go forward, and I got to constantly am moving my back up when I can to when I remember.
Well, one of the other things that makes us shorter or seem shorter is if we're carrying extra weight. You know, it's kind of pulling us forward. I'm not saying that you have
Oh
that problem, you know,
go right ahead. It's a great description there.
because the lower back,
Gravity is working against us.
the lower back just takes is especially vulnerable because it bears more of the body weight, and then of course it can cause arthritis, and there's a lot of things that can happen. And kidney stones. Have you ever had kidney stones?
I have a couple times, yeah.
That's right. I remember that.
It's been a while, knock on wood, but yeah, a couple times. Not fun, horrible.
No, did yours? You didn't have to be operated on.
So no, but the first time that I got them, I went to Sutter. I didn't know what it was. I had an idea, but I didn't know what it was, and they did like an ultrasound on me or some sort of put me in something to identify they were there, and then they zapped them. They said with microwaves or something to break them up, and they said, well, you may feel them pass, you may not, and I didn't feel them pass. So I guess they were probably small enough that they didn't. And then the next time I went in, they didn't zap them or anything, and they just said, here's your strainer, catch them on the way out. And I definitely felt those ones
Oh,
that
did you?
time. Yeah, and still have it, actually. I have it in a little glass vial. I saved it.
How many did you have?
Just one.
Just one.
I only caught one. I mean,
Yeah.
that was it, yeah.
Yeah.
Just the one that time. So,
Well, if you get a back pain, that could be. They're very common. There are about 1.3 million visits in 2009 from kidney stones. And for some reason, I didn't know this. In the summertime, it's much worse because of dehydration.
oh, sure, yeah.
And, I know when I'm giving somebody a flu shot, and I have a little bit of hesitancy to go into somebody's arm, that they're dehydrated. And I will always tell them, has anybody told you they were dehydrated? And this one patient I had the other day said, I was just at the dermatologist, and they told me the same thing. So, but we were talking about back pain, and whether you have it or not, you should seek medical attention if you have a high fever, vomiting, bad smelling urine. It could be almost anything. It doesn't always have to be your back. So as we talk about things, you think about being a hypochondriac, and if I if I went in to see the doctor every time something was different, I mentioned to my wife a couple nights ago, I said I did something to my my rib. I said it's sticking, I can feel it punching into the front of my back, and the rib that's broken is the back 3 ribs from the bottom up. And she said, well, go in and get an x-ray. And I says, I'm not going to go get an x-ray. I said, it happens occasionally, but they're just trying to find a place to attach to, and I'm up and down and doing things, and then when you fall on the same ribs and break them the second time, they don't know whether to go back to the same place.
They don't know where to go anymore.
Or not, but it's getting more difficult and difficult as time goes on to go into a doctor and see those kind of things unless you have a regular physician. Or a lot of these insurance companies have protocols now where they're not going to pay for you if you go into the emergency room. You have to go into a clinic. And not every place has an ample supply of clinics. When I was in Hawaii, I tried to go to a clinic, and when I broke my ribs the first time, and I was told to go to the hospital. Walked into the hospital. There was nobody in there. There was 4 people in the waiting room and a receptionist, and it was a huge waiting room. And I didn't think they would take me, and they said, sure. And saw a physician, had an x-ray, was told what to do what they could do to help me, and the answer was nothing. Because when you have a broken rib, you don't bind yourself up anymore. There's too much danger of collapsing a lung, which I had begun to do. So it's become, I'm doing Medicare D plans now for people to see what kind of Medicare plans they have, and there's a lot of restrictions on what you can do and what you can't do. And by the way, if you're on a Medicare D plan too now, and you want to stay on it, you need to check and see what the rate is. I had one yesterday that was Express Scripts, and it was the total amount they paid out last year was $520. The beginning enrollment this year on the same plan, all I did was change the year, was $6,000. That's how much it had gone up. From their total expenditure last year was less than $1,000 on all the medications they were taking on their Medicare D plan, and it was $6,600 this year for exactly the same thing. So we have to, just because it's a plan you had before, and it was probably the best plan, that was one of the best plans that they had last year, and it has changed substantially. So I was shocked. I went back again and put in the same insurance plan and got the same results. I'd like to remind you we're North Lake Medical Pharmacies with 2 locations for you. At 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, 263-1328, and get your flu shot today. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM KXPX Lakeport.